Hello, my name is Immanuel and today I'm going to be discussing pharmacokinetics of D3 receptor analogs and potential drug therapy for cocaine addiction. The outline of my presentation will include an introduction, purpose, the methods, results, conclusion, and future research. There's about 2.5 cocaine users in America today. So you may ask, what is cocaine? Cocaine is a psychostimulant that activates the brain reward center, causing the state of euphoria. Euphoria is like ecstasy, a state of well-being. This may sound, pleasurable. However, cocaine is very addictive. 75 people, 75 people out of 100 people, 75 people who try cocaine become addicted. And 80% of the people who try to stop cannot. There are facilities that exist that help individuals with cocaine addiction. However, there's no pharmacotherapy that exists for cocaine addiction. So right now, we should look at how cocaine actually works. Normally, dopamine is pumped out of the presynaptic neuron into the synaptic cleft by vesicles, which then binds to either the dopamine receptors on the presynaptic or postsynaptic neuron and reuptake it into the presynaptic neuron or to the postsynaptic neuron by the dopamine reuptake transporter. So a visualization of this looks like that. However, when cocaine is introduced into the model, cocaine binds to the dopamine reuptake transporter, which then blocks dopamine from binding to the binding to the dopamine reuptake transporter, which allows the dopamine to persist within the synaptic cleft, which then causes the effect to persist. So what we want to know is what kind of receptors actually is responsible for this action. So studies have shown higher expression of D3 receptors after exposure of drugs, which can be seen in this figure. The red region is individuals with a high level of cocaine addiction, and you can see the drug-free picture. You can see that there's not as high levels as D3 receptors as the one with cocaine addiction. And so we want to find molecules that actually will bind to the D3 receptor, which then can block the dopamine to bind back to the D3 receptor, which causes its effect. So this is another visualization of it. The cocaine will bind to the dopamine reuptake transporter, and then these D3 analogs will bind to the dopamine D3 receptor, which would then allow the dopamine to persist within the synaptic cleft and then eventually dissipate. So the total purpose of this experiment was to determine the pharmacokinetic parameters of these D3 receptors and see if structural modifications will affect how much of the concentration of the drug will get into the brain. All right, so NGB2904 was our template structure, and the other compounds are the ones with slight modifications. From here, we did the experiment by injecting these rats with 10 milligrams per kilogram of each analog and euthanizing them at different time points to find out the concentration of the analog within the brain and in the plasma. This was done by using the HPLC, high performance liquid chromatography, which then we found the pharmacokinetic parameters by non-compartmental analysis using the software WinNonLin 5.2. And the results showed that the pharmacokinetics, we had a vast amount of pharmacokinetics. However, we were mainly interested in two, the AUC and the clearance rate. And AUC is the area under the curve. So that basically means how much of the drug is going to be there throughout time. So what we did was see the ratio between brain and plasma to see how much of the plasma was entering into the brain. And then the clearance rate was the amount of drug leaving the plasma, which then gets into the brain. And this is an actual visualization of the area under the graph. The blue circles represent the concentration of the drug within the brain, and then the red circles represent the concentration of the drug within plasma. From here, we saw that out of the 4 compounds that we used, NGB2094 had the highest area under the curve ratio between the blood and the brain, and the lowest clearance rate. And further research that can be done is basically to see the pharmacodynamics of each compound, which basically means to see if the compound actually lowers cocaine addiction, and to try other compounds from their selectivity if they will actually cross the blood-brain barrier. And my acknowledgments is for Dr. Eddington, the people who work in my lab, and the Marquis Style program at UMBC.
Thank you.
There is time for questions. So do you know what is the typical, you said there is no therapy, right, for cocaine addiction, but
Pharmacotherapy.
yeah, but there is definitely some treatment that is being implemented at these rehab places. Do you have an idea of what the methods that these guys are following?
They're using behavior studies to find out if to try to lower cocaine addiction, not actual drugs. So.
And they're trying to diminish the doses that these patients are taking?
Basically, if you take the person outside the environment where they can access cocaine, then therefore they would stop using it. There's actually so there's no actual medication for these individuals.
They're probably just doing something to treat the symptoms, the withdrawal syndrome or things like that, right?
Yeah.
So having a therapy will really help getting these people off.
Yes.
So spanning out with, blocking the receptors, are you guys going to try and span this out, like, among other drugs as well? Like, other things that people can get addicted to, like meth and things like that?
Our main focus is on cocaine addiction, so we're just trying to see for this. We're just trying to see if it works with cocaine addiction. We haven't expanded it for other addictions as well.
So, anything known about the genetics of the propensity for becoming dependent on this? What is the difference between people who become addicts, hooked on the drug, and people who can use it and walk away from it?
There haven't been any studies on that yet. We were mainly focused on finding molecules that would bind to the these dopamine receptors, which then would block cocaine, which then will block dopamine from binding to them. So no, there has not been any studies done on that yet. Any other questions?
Okay, if there are no more questions, thank you.